Yeah, so I have two mini coronavirus stories. The first one is based on a very small study, but I found the results to be very interesting. So, in this study that took place in India, there were a group of 62 health workers. These health workers were assigned with visiting residents where one of the members of the household had tested positive for a coronavirus. So they were supposed to, they would go and visit their residents in order to speak with the other members of the household and tell them about things such as proper sanitation when it comes to coronavirus, social distancing, quarantine, symptoms of coronavirus. So they went there to speak to these other members of the household, but of course someone in that house had officially tested positive. So they had all the gears that you could imagine. They have triple layer face masks, shoe protection, gloves, everything, all 62 of them. And during the first 10 days that they went and visited people in their household and at home, 12 of them got infected with the virus. So after 10 days, they stopped, and these 12 had been infected. And the interesting thing is that none of them had any interaction with the community. They were all kept in separate room in hostels, and the health workers spoke with each other by phone, and they all each had a dedicated van, I believe, that was separated, that was a barrier separating between them and the driver. So they were quite isolated. The only communication you would have were with members of the household where they would visit them, and if there too they were supposed to keep a meter or so distance between them. But anyway, after that the 12 tested positive, then they took a 3-day break and they restarted. But once they restarted, they introduced face shields. And during this time, the second period was actually 6 weeks long, so much longer than the initial 10 period. And during this 6 weeks, none of them got infected. So nobody, not even one person got infected, as opposed to 12 who got infected when they weren't wearing the face shields. So I know this is a very small study. It only had a sample of 62 people. Although for some people who have been reading coronavirus studies, this is not that surprising. I mean, you can't blame people. They can't have huge studies put together in a few weeks. But a lot of studies, whether on treatment or other things, are based on very small samples. But I just found the results to be very strong. So that's really what caught my attention. So pretty much 19% initially, 19% of the group had gotten infected before the introduction of the face shields. And when they introduced face shields, even though they visited countless homes where people had been infected, far more homes that they had when none of them were wearing the face shields, nobody got infected. So I found the results to be very interesting, and I guess face shields do play a big part for people who are, I mean, more research needs to be done on their efficiency, and they're already being worn by a lot of medical and other frontline workers, but the results were very interesting. And then I had a second story, and this one was about testing in the United States. So as everybody knows so far, if you're going to get tested for the coronavirus, they stick a cotton swab all the way, from what I heard, up your nose, and I don't know, it goes near your brain, or anyway, it's supposed to be very uncomfortable, and they have the other one where they stick down your throat. But now there's a lot of saliva-based tests that are being developed. There are currently 5 in the US that have gotten FDA approval for testing. And one of these that made the news this week is apparently largely funded, both the development of it and the testing, by the NBA. Some of you may know the NBA has resumed its season, but they're quote unquote in a bubble right now where everybody involved for the rest of the season is kept in a small area at Disneyland. I believe they've dedicated this area to them, but they're getting tested all the time, every day. So of course there's a lot in for them to develop easier tests that are less intrusive. But this saliva-based testing, what is interesting about it is that apparently the results will come in even faster than the other 4 that have gotten approval by the FDA to get tested. And this is because the other ones being tested, they have an extra step where you have to separate the genetic material from the nucleic acid from the sample. Therefore, to perform the test, labs don't need special kits to do this. So this is why this test is even better, at least if it's proven to work properly. It's going to be better than the other saliva-based tests that are being tested right now. And early testing has shown that it is quite accurate, around 94% accuracy. And on top of that, there has been one study that's come out on it so far, and in that study they say that it's going to be extremely cheap, somewhere between $1.30 and $5, if this test eventually becomes available for the general public. So this was just a very nice, interesting development. Of course, there's a whole vaccine side to coronavirus, but also having faster, cheaper, more efficient testing is something that not only in the US but the world needs very quickly. So those are just my two coronavirus updates that I had for today. I don't know if you had any questions or anything to add, Sam?
Just one question, because there was always a lot of chatter about the accuracy and inaccuracy of tests. Do they say how accurate this saliva?
Yeah, apparently early testing have shown that it's quite accurate, at least comparable to the traditional type of swab testing. I'm just reading off this Forbes article where I found this information, and it's based on one study that has been done. I don't have the name of the university under my eyes right now, but the testing has been transferred to one of the prestigious US universities. I forgot the name right now. But what did you also
That's
think?
good.
What did you think of that study that I mentioned? Do you think the sample size makes it too ridiculous, or at least it's a start, and just the results make it noteworthy enough to pay a little bit attention to that study and the importance of face shields?
No, I think it's a good, yeah, I think it's a small study, so it's a good first step. So now you know, all right, this is something worth testing at a large scale. I definitely think that. But I'm generally of a view that, what you say, that, yeah, you need larger samples and longer term test studies to make sure. But yeah, I think it's a good first step, and for, like, a lot of studies are made for a specific reason at this for a specific time, and I think that's the case with this study. It may not be a great study looking back 50 years from now on understanding the effects of corona and all that, but it's a good study for its own purpose, I think.
Yeah, and for some of you who might be interested as to what could be perhaps the mechanisms that these face shields are stopping, so the authors have just very something small in this. This was not part of their study. They weren't there to speculate on the reason that why face shields were effective, but they wrote that the face shields may have reduced ocular exposure or contamination of mask or hands, or may have diverted movement of air around the face. That's just kind of the small explanation that they give in their discussion section. But that wasn't the main point of the study, to figure out why face shields are effective.
If I may add a slightly controversial note, I don't know if you'd be happy with this or not, but when a virus is as contagious, because I was reading an article about how mask may, cause less oxygen to go in and then cause that or this. And when a virus is as contagious as this one is, I don't think masks or shields are a lifesaver. And at the same time, I don't think a mask and a shield is gonna affect your breathing. I just think people are either expecting too much, or just looking. It's like stupid details, in my opinion. Like, it's not, we live in cities with extremely polluted air, and now they're worried about whether, like, mask has a 1% effect on the level of oxygen going in and out. I just sometimes some of these things are seem to be really focusing on insignificant details.
I mean, I largely agree with you, especially with the part that you're saying people are like, oh, oxygen issues and all that. I mean, that just seems to be really narratives coming out of the United States. I haven't heard anything official. But then when it comes to the impact of masks, studies so far have shown that it is one of the more effective ones at not spreading the virus. Now, I think at first there was a lot of confusion. People thought that you put the face mask and you're like bulletproof, as if it's
Yeah,
some kind of like gas mask that's or something that's made for you to walk on the moon. but the main purpose was just to like stop people from like their saliva, I guess, like, spitting all over others. So it seems to be quite effective uh, to that extent. But I mean, personally, also when I wear the mask, I mean, it feels. I'm not talking about the oxygen part, but in the U.S. they talk about it's not comfortable and all that. Sometimes I realize that if I wear it for 30 minutes, I completely forget that I'm wearing it. It's kind of like anything else. So you just have to get used to it. And it's really not that big of a deal, I find.
No, I agree. It's not that big of a deal. I never tend to forget it because of the heat and all that. But but I don't think it's a big. It's like an umbrella I don't like. Yeah, I just don't understand such a big. They're making such a big deal out of a
A
small
small
issue.
issue.
To
But
be
I'm
fair, in
glad.
the U.S. they're making other places,
I
I'm sure too, but
no. Yeah, I think it's everywhere, just to different degrees, I think. But yeah, in the US, more so than others, for sure. But yeah, I'm glad there are some research with some, at least some positive signs for future.